So New South Wales recorded 6 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. All 6 cases are close contacts of the Western Sydney case reported yesterday. So this brings the total to 4,877. There were 12,764 tests reported to 8 p.m. last night, and that's a decline on testing levels. It is critical that we get those testing rates up very high so that we can detect these unrecognised chains of transmission. And the areas that I'm particularly calling out for testing are in Bankstown, Lidcombe, Auburn, Baralla and Wentworthville. So my plea applies to everyone across the state, but particularly in those local government areas as we're trying to mop up any last chains of transmission. Can I also say and extend my appreciation to the cases that we've notified over the last couple of days. We understood and have identified this household transmission and these cases because of the actions of those individuals. They responded to calls for coming out for testing, and they are the true heroes, because you can see by recognising the trains of transmission, by testing around those cases, we've identified further cases and been able to stop any further spread into the community. So I extend my greatest appreciation for your cooperation. So of those 6 locally acquired cases, all are close contacts of the Western Sydney case reported yesterday. The investigations into the source are continuing, so we don't know the exact link to their source. We are waiting for genome sequencing, which will be available later today. That will give us some insights into terms of what genomic linkage is, whether it's Baralla or Avalon or keeping our options open, but they would be obviously what we would be considering. One of these members is a worker at Concord Repatriation General Hospital, and they're now in isolation, but did work some shifts whilst in the cardiology and radiology wards whilst potentially infectious on the 12th, 13th and 14th of January. But the person's role involves minimal patient contact, and they also wore a face mask during each of their shifts. So it is pleasing to say that the 7 close contacts, their workplace contacts, have already been tested and tested negative. Obviously, they will then be placed in 14 days quarantine, and we will ensure that they're tested repeatedly and will update you on any further cases. There's also a number of staff that have been identified as casual contacts, and they're being followed up by the Public Health Unit. And as I said, investigations are ongoing, but there is no ongoing risk to patients or staff. Close contacts have been identified and are isolating. Routine testing is being undertaken, and the environments in which the person worked have been effectively cleaned. So just want to reassure people that please continue to access care from Concord. There is no ongoing risk to patients or staff there. Also, last night we issued a number of alerts relating to new venues and some train services. So again, I urge the public to keep up to date on the New South Wales Government website. But anyone who went to the Wentworthville Medical and Dental Clinic at 122 to 128 Station Street, Wentworthville, and who was in the dental, physio and imaging waiting room, I believe that's a shared waiting room, on Friday the 15th of January, between 11:30 a.m. and 1:15 p.m. is a close contact who must immediately get tested and self-isolate for 14 days regardless of the result. And people in other areas of the clinic at that time should monitor for symptoms and immediately isolate and get tested if they appear. And then anyone who was at the Auburn Centrelink at 5 to 9 Macquarie Road, Auburn, on Thursday the 14th of January between 3 p.m. and 4:15 p.m. should also monitor for symptoms, and if they appear, immediately get tested and isolate until a negative result is received. We've also had a positive sewage detection in Glenfield. We are aware that there is some cases in that catchment, but as a precaution, we really are again urging the population to come out in those suburbs of the treatment plant in Glenfield. So that catchment takes in a very broad catchment from suburbs like Ayres, Amberville, Appin, Campbelltown, Casula, Ingleburn, Minto, Raby, Roos, just to name a few. So please go onto our website, and if you are in that catchment, again, the most minimal of symptoms, please come out and get tested. Thank you.